smoking. Okay? Now, it's very important to really understand the impact of smoking in gastric surgery. Smoking does reduce the blood supply to various tissues of the body. Okay, we all know that it can put you at a high risk of respiratory problems, pneumonias, heart problems, strokes, God forbid, cancers. But often you may not recognize that it does affect the vasculature of the tissues of the body, including the stomach, including the soft and hard tissues like bone. So if you talk to an orthopedic surgeon, they will tell you if they're planning on doing a back surgery with bone grafting, absolutely no smoking, because that graft won't take. The same way with the gastric surgery. If you're planning on continuing with smoking and you don't stop smoking, that affects the blood supply to the vessels into the stomach. The lining of the stomach is very fragile. It sheds, it doesn't heal, then you get an erosion, and eventually you get an ulcer that is refractory. It's a nightmare. It's miserable. Okay? And I've had patients I've got 12, 13, 14 of these patients, some of which stopped smoking, things stopped, some of whom didn't, and they continue to have problems. The problems they're going to have is, number one, everything you eat or drink will hurt you, and you have chronic pain, and the medications won't necessarily heal these ulcers, and you end up having a revision surgery, and they are no fun. High risk of complications, and that is not necessarily always the final solution either, and you can ulcerate again. So no smoking, active or passive. So if families smoke, you have to ask them to smoke outside. If you're smoking, you shouldn't be doing it, and really stay off of it for good. And this is a health initiative, so there's nothing more important as a health initiative than smoke cessation, okay?